So now this image is very important here because I think all of you will know that stretch reflex. Stretch reflex is nothing but the afferent which comes from the muscle receptors. Then it goes to the posterior root. It gets into the spinal cord. Then you have the monosynapse, the synapse occurring in the anterior horn cell. Then you get the efferent from the anterior horn cell, the peripheral nerve, the muscle. So when you stretch, this monosynaptic reflex causes the muscle to contract. So that is what we call it as a stretch reflex. So this stretch reflex is actually controlled. Otherwise, normal activity is not possible. And most of us we know as an undergraduate that stretch reflex is actually controlled by the corticospinal tract. So we tell that corticospinal tract will inhibit the stretch reflex. So when the corticospinal tract is damaged, the stretch reflex gets exaggerated, which is clinically perceived as the exaggerated deep tendon reflex. But remember, the newer concepts are actually different. Now what they tell, more than the corticospinal tract, the dorsal reticulospinal tract is a very important tract which inhibits. So here the light arrow is inhibitory, the dark arrow is facilitator. So here the message we get here is that not only the corticospinal tract, but more importantly the dorsal reticulospinal tract suppresses the stretch reflex activity. So when the damage occurs to the corticospinal tract and more importantly the dorsal reticulospinal tract, you get an exaggeration in the tone as well as in the reflexes. Now it is not the inhibitory thing alone. So there are facilitatory pathways which actually facilitate the occurrence of stretch reflex. So though we assume that it is a kind of a spinal reflex completely controlled by the spinal, only inhibited by the supraspinal pathway, it is not so. So you have the supraspinal pathway which can actually be facilitatory or it can enhance the reflexes. One is the medial reticulospinal tract which I mentioned here, and another one is the vestibulospinal tract. So these are facilitatory. So only when the inhibitory pathways do not function but the facilitatory pathway continue to function, you get an exaggerated reflexes as well as the tone. So the mechanism for the tone and the reflexes are more or less similar. I'll touch upon the differences in the subsequent classes, but I want you people to understand this process very clearly. Now, the premotor cortex through the corticoreticular tract stimulates the medullary reticular formation. So though it stimulates the medullary reticular formation, the fibers which come out of the medullary reticular formation actually inhibit the reflex arc. So the premotor cortex also should stimulate the medullary reticular formation, which will in turn inhibit the stretch reflex through the dorsal reticulospinal tract. So here only the cerebellum is coming into the picture. In cerebellum, you would have seen that you can have a tone which is fluctuant. You can have a decrease in the tone. Now this decrease in the tone is actually mediated through the enhancement of the inhibitory pathway of the dorsal reticulospinal tract through the medullary reticular formation. If you are not able to understand the pathway of tone being affected in cerebellum, don't get confused much. You can read the article again, but at least try to remember these four arrows. So the two inhibitory pathways and the two facilitatory pathways. Again, this is a reasonably newer concept. I would say that maybe about 10 years old, not that well described in standard neurology textbooks, but understand and keep it with you. It's very relevant when you do neurology at the bedside, and in case in assessment, if you are led to by the assessor, then you open up and tell the track. But what most of them will expect you is to tell about the corticospinal tract, the lack of inhibition from the corticospinal tract. But actually, theoretically, you should remember all these four tracts.